Oh, there you are. Good to see you, man. Good to see you.
It's 6 weeks since Joe and Rob had their kidney transplants at the Churchill Hospital in Oxford. It's time to check their progress, and today they're meeting other young renal patients at a specially organised clinic at a sports centre. These clinics held outside the hospital have been life-changing for young patients in the Thames Valley.
It's made a huge difference because when you come here, it's a bit awkward at first because you're meeting new people, but you start talking and you realise your situation isn't unique, and you realise that they've had similar things, so you're not on your own.
So, you enjoyed that experience?
It helps you come to terms with it a lot better because you know you're not the only one, and you can share, you can have support from them, and you get new friends as well, so who know what you've been through, so are more sympathetic towards you.
It's a long way from the traditional renal waiting room, and this environment has really helped 16 to 25-year-old patients who previously struggled with the leap between paediatric and adult care.
You just kind of look around and you're in a room full of 70 and 80-year-olds, and you just think, oh, I shouldn't be here, but you obviously are. It doesn't make you feel too great. You're just kind of thinking that you're too young for this. It's when you see a lot of people, other people same age, doing fine, you think, oh, I want to be like them, I want to be fine as well. So you're less likely to not take your medication.
After meeting for coffee, it's time for some fun. Today, a game of squash, organised by Dan Lonsdale. Dan became involved with the young adult clinic after donating a kidney to his brother Jamie 2 years ago. He's now been appointed as a youth worker as part of a national initiative by NHS Kidney Care to develop better support for young adults.
It can be quite daunting entering a group of people that may have met 2 or 3 or 4 times, coming in as a new person. So I think a key part of someone does my sort of role would be to introduce people and then to kind of start the games going.
Okay, so Joe, it's your turn now. You're going to come with me? Okay. How are you? All right, good. How's the last week been?
During the squash games, consultant transplant physician Dr. Paul Harden begins the clinic appointments. The patients are taken to a private room within the sports centre.
It really started through my experience of managing one particular paediatric case that was transferred to me at the age of 16. And this particular young man initially came to the clinics with his parents, then on his own, and seemed very independent. But within about 10 to 12 months, things started to go wrong, and he stopped taking his tablets regularly, which ultimately led to him losing his transplant within about 2 years. And his life collapsed. And I felt that if we'd had a better connection with the paediatric service, and he'd had more support from peers in a similar situation, maybe we could have averted this.
Dr. Harden began by organising young adult clinics at the hospital, but felt the social interaction was limited.
In a community setting, particularly a sports centre or a college where there maybe is a common room with a pool table or a squash court, then the youth worker can instill various activities and competitions between the patients which keep them there for some hours and instills much more interaction and peer support than you could ever achieve in the hospital environment.
Ah, nice, Tom. Good shot, that. Watch that. 2-2.
There's the logistics of actually physically taking the notes and the blood pressure taking equipment out of the hospital and setting up a temporary clinical scenario. But this is not that difficult, and if you want to make it happen, you can make it happen. And I don't regard it as difficult. These patients would have to be seen in an ordinary clinic at the hospital anyway. All you're doing is reorganising the structure of the clinic so that they occur at the same time. All the young patients are seen at the same time in one place, and for that particular day you're taking some of the service to them rather than them coming to you. The patients can still see a pharmacist, they can still see a nurse practitioner, they still see a doctor in a totally normal community setting, as opposed to an abnormal clinical setting in the hospital for patients of this age.
The clinics are always followed by a lunch, which is paid for through fundraising. Since the clinics began 4 years ago, there's been a dramatic change in the statistics.
In our experience in the Thames Valley region, before the clinic was set up, we audited a 5 years experience of patients transferred to our care from the paediatric hospitals in London, and we found that nearly 2/3 of them lost their transplant completely within 4 years of transfer. The young adult clinic in the community has been running now for about 4 years, and since 2006-07 we haven't had a single transplant loss of patients that have been transferred through the clinic. So that in itself is a major improvement. But more particularly, we haven't had any rejection either. And certainly there were rejection rates at 12 months after transfer of as high as 25%.
After lunch, there's normally an afternoon activity. Today, they're tenpin bowling.
It's made me a lot more positive because I realise, because you see some of these guys and you don't think you're ever going to be fit again, but you see some of these guys, they're proper fit, and then you go to the other events and you can just see the benefit of it, and you can tell that it's not going to be all bad, you're going to get good eventually. Yeah.
The Oxford team had the largest group of young people at this year's British Transplant Games. It's thought this is down to the friendship and team spirit that has built up within the young adult clinic.
I think one of the most valuable things that this clinic does is it brings together not only patients that have been transplanted, but dialysis patients and transplant patients and patients that are all various stages of renal failure and treatment all together in one room. So it really has a complementary effect from both sides, to say that the dialysis patients can benefit from meeting and talking to the transplant patients, because that really gives them, inspiration and a goal to work towards, to see that, dialysis isn't forever. And then on the flip side, for transplant patients, to be kept in contact with dialysis patients, I think it keeps the reality of their condition, the fact they are still on medication, on a transplant, and how lucky they are to be in that position. It really, really brings it home.
I would like to see other centres in the country adopt a similar model. And already through the NHS Kidney Care Supporting Young Adults initiative, we are beginning to see some other clinics in the East Midlands, in the London centres, that are following a similar model. And there is a recognition that you do need a team approach to this. It's not just about having a doctor or a nurse practitioner, but you do need somebody that's a patient advocate, such as a youth worker, or somebody to catalyse the peer interaction. The young people are our future in the whole of the society and community, and we should be trying as hard as possible to ensure that young people with chronic disease have the best chance for the future to lead a normal life, to go to university, to acquire the normal skills that any other individual has, and to get a normal relationship and have a normal family. And it's very inspiring to see some contribution towards getting these patients back onto an even keel so they can achieve those goals.
It's definitely made me think like I can achieve a lot more now. Because obviously not feeling great before the transplant, you're a bit down, not really feeling too great, and now you're like fresh, more energetic, and feel like you can achieve anything really.
You don't feel alone anymore, you feel like people are here to support you, and you feel like you feel a lot more positive that you can do things with your life because you see other people doing it, so why can't you?